Thank you very much, Chris. I appreciate the kind introduction, the long version, so to speak. We appreciate that very, very much, and we appreciate all the work you do. You know, Chris, when I first ran for the United States Senate, you probably know this, I said I wanted Washington to look a little bit more like Montana, and I guess with you and I here, we're getting there, okay? Get a little close to that goal. It is a privilege to be here today with so many folks who work so very, very hard in rural America. As Chris said, I am a third-generation farmer from a little town in north central Montana called Big Sandy, population 710. Now, that's not rural. Big Sandy is a frontier town. So I appreciate all that you do for rural and frontier America, and I'm proud to be a partner in so many of those efforts. I'm also a member of the Senate Veterans Affairs Committee. That gives me a seat at the table to be a voice for rural veterans. You know what rural America is all about, and because you know rural America, you know why I'm passionate in my support of our troops and our veterans. Because more and more, our troops are coming from small towns like Fresno, Montana, or Manhattan, Montana. Today, nearly half of the military recruits come from areas like those, even though only about 20% of Americans live in rural America. I'm especially proud, in fact honored, by the service of Montanans of all ages who have fought for our country. And when they go to fight for our country, they make tremendous sacrifices. They leave their families, they leave their friends, they leave their communities that they call home. While they answer the call of duty, we look after their families and we pray for their safety in the field. And when they come home from serving our country, we know that they have earned the right to the same quality of health care and the same benefits as a veteran who comes from Fresno, California, or Manhattan, New York. And when it is time to make good on that promise, our nation's promise, to give these folks the health care that they've earned, we know that there are really two things to do. Make it easier for the veteran to get to where the health care is provided, or bring the health care closer to the veteran. For too many years, while our nation was at war, Congress did not provide enough resources to accomplish either one of these goals. But by working together, we've got some long overdue funding for the VA. Because of those increases, I'm pleased to report that we've made some good strides in the last few years on both fronts. We've increased the reimbursement rate for veterans who have to travel long distances across rural America to VA facilities. And we've gotten the VA to open up more clinics and establish more contract clinics with you. You folks fight to provide quality health care every day in rural and frontier communities. But there's more to do, and you know that. And I know you will continue to play a critical role in that effort. We know that when a VA clinic closes for the evening, it's the local hospital that becomes a VA clinic until the next morning. That means rural health providers must be partners with the VA, and you are already doing that. Now we've got to continue to build on those partnerships that the VA has established with private and community mental health providers. We need to work together to make sure that PTSD and other invisible injuries are treated quickly and they're treated properly. That is why we need to continue to invest in information systems that work for rural providers and that work with the VA system. We need to harness technology by investing more in telemedicine. We need to work together to find new strategies to get outstanding healthcare professionals to come to work in critical access hospitals, in VA clinics, and everywhere in between. And above all, we've got to trust that rural health providers can be reliable partners in the shared goal of improving veterans' health. That is why my Rural Veterans Health Improvement Act is all about. Strengthening the VA and strengthening the relationship between the VA and the folks who stand on the front lines of rural health care. It will take all of us working together, but I can tell from the enthusiasm in this room that we're moving together in the right direction. As long as I'm a member of the VA committee and a member of the Senate, you will have an ally in me as we continue to work together to make health care better in all rural America, especially for our veterans. I want to thank you very much for your time today.